Hello everyone, good afternoon to one and all. Welcome to another edition of MGM Healthcare Interactive Session, and our topic for today is awareness and prevention of dengue. Dengue has been making rounds in and around us, and we all see a lot of anxiety and questions in everyone's mind. So today we are here with a panel discussion on the same topic. In the panel today we have Dr. Sivaraj P., a senior consultant in the Department of Internal Medicine and Allied Sciences at MGM Healthcare, with nearly 15 years of experience in internal medicine, diabetology, critical care, geriatric medicine, and infectious disease. We also have Dr. Madhumitha R., a consultant infectious disease. Department is Internal Medicine and Allied Sciences at MGM Healthcare. She has over 12 years of experience in the field of infectious disease, tropical medicine, and infection control. Next, I would like to welcome Dr. Sabhanayagam V., Senior Consultant and Clinical Lead, Multidisciplinary Intensive Care. With 15 years of experience in anesthesia and intensive care medicine, he also heads the Department of Multidisciplinary Intensive Care. Next, I would like to welcome Dr. Nisha Miriam George, Senior Consultant, Paediatrics and Neonatology. With over 15 years of experience as a general pediatrician, Dr. Nisha has a special interest in the areas of emergency room care and inpatient care of children and adolescents. Thank you, doctors, for joining us. We welcome you all. And without any further ado, let's start the panel discussion. So my first question is for Dr. Madhumitha. What is dengue?
Good afternoon. Thanks for that question. Dengue is a viral-borne illness caused by a mosquito bite. The mosquito is called an Aedes mosquito. Some interesting fact about these Aedes mosquito is it's found in the tropics and the subtropical regions, typically where we live. And they usually bite during the day, and only the female mosquitoes bite. And sometimes these mosquitoes are also called as tiger mosquitoes. And another interesting fact about this mosquito is this mosquito can have multiple blood meals in a single day, which means it can bite multiple members of the same family, and multiple people at the same time can fall ill with dengue.
Thank you, doctor. My next question is for Dr. Sivaraj. What are the major causes of dengue?
Good afternoon. Thanks for the introduction. As Dr. Madhumitha said, dengue is a viral infection. So it is caused by a dengue virus. It has got 4 serotypes: type 1, type 2, type 3, and type 4. How is it transmitted? By mosquito bite. It belongs to the family of Aedes, and the species is aegypti. It's a common thing is Aedes aegypti. So basically, as she said, it's a day-borne mosquito, and it's usually found indoors as well. It most commonly breeds in stagnant water. The climatic conditions during the rainy seasons, the temperature is usually ideal, and this humidity favors the viral propagation and also the larval replication as well.
Thank you, doctor. Dr. Nisha, would you like to tell us how dengue can affect children?
Thanks, Ms. Shanu, for that question. Yes, so many of you would already know that dengue definitely affects children. I'm sure the television, the newspapers all tell us that. And over the last few years, definitely we've seen more and more children getting affected, especially after the rains settling. So 15 years ago, pediatricians across India, we weren't very clear about how to manage dengue. We had some ideas, but over the last 15 years, a lot has been understood about this illness. And the Indian Association of Paediatrics has taken it upon themselves to disseminate this information. So all across India, Tamil Nadu, Chennai, all of us as pediatricians are very clear now about how to manage dengue. Why is this important? Is that it has now become more and more understood that if appropriately managed, most of the children with dengue can recover and do well, so even if they have what is called severe dengue. Children who have dengue, so across all age groups. Now, dengue is most statistically known to affect children less than 9 years, but it can affect children across all age groups. The two specific age groups that we are very concerned about often are the children who are infants, that is less than 1 year of age. Infants have to be managed much more carefully when they have dengue. And a couple of years ago, we found that a lot of adolescents, when they had dengue, menstruating girls of the adolescent age who have started having their periods, and sometimes a lot of obese individuals can have more severe versions of dengue. But dengue can affect any age of children. So how do these children manifest? Yeah, so younger children, the small babies, most of the time dengue is as the doctors before me have said, it's a viral fever. So they present with just fever. And unlike the usual viral fevers that you often find in children where they associate with cold and cough and runny nose, most of the time dengue is just an undifferentiated fever, that is, just fever alone. Sometimes children have a little bit of vomiting, but most of the time it's just fever. So as we go through the session, you'll understand more that dengue comes in 3 phases. The first is a febrile phase where children have got fever for even up to 5 to 7 days. Then the second phase is the most important, where the fever is going, and that is what is called the critical phase, where that is when children can have complications of dengue. Then after the critical phase, children automatically go into the recovery phase. So as pediatricians, it's important for us to know that it is important to pick up dengue in the initial time. Why? Because then we can monitor children closely if we know it's dengue, to understand whether they're going into severe dengue with what we call warning signs, or if they're going to just have undifferentiated just dengue fever. So closer monitoring and picking them up early, and then we will decide whether children need admission and things like that. So that's how dengue affects children. But finally, the message is that now that we know so much more about dengue, the initial management, the close follow-up, the close monitoring, all of that makes dengue very treatable.
Thank you, Dr. Nisha, for the detailed answer. Dr. Sabha, we would like to know that are mosquitoes the only reason for dengue?
Good question, Shanu. We know dengue from almost like 200 years now. There has been lots of evidence saying that we've been fighting this disease for like 2 centuries. And as Dr. Nisha said, we are learning more and more about this disease in the last few decades. From what we understand, vast majority of these infections are caused by mosquito bites. As Dr. Madhumitha was saying as well, it's a specific type of mosquito called Aedes, which bites mostly during the daytime and all that. So vast majority of the infections are due to mosquito bites. But having said that, it can also be caused very rarely by blood and blood product transfusions, because for those people whom the mosquito bites and develops an infection, the viral load in the blood can be very, very high. Now, as a result, when that blood is transfused to people who require that, there is a chance that the infection can be transmitted along with that. That's one reason all the blood and blood products that are actually given, donated and transfused are being tested for dengue, one thing. And there is also a rare chance of this infection spreading through needle stick injuries, which most exclusively happens in the hospitals, very rarely among IV drug abusers. So basically it's mosquito bites and rarely in the hospital setup. Yeah.
I would like to add one
Yes,
thing.
please. Yes.
There are very few reports of transplacental transmission also, which is like from the mother, the virus can be transmitted to the child. So again, this depends upon when the mother got dengue. So if it is closer to her delivery date, yes, she can transmit the virus to the baby during the delivery. And these are very, very rare incidences, but that's another mode of transmission of dengue virus.
Thank you. Thank you, doctors. So, Dr. Sivaraj, we would like to know something about the hygiene and sanitization factors related to dengue.
The hygiene and sanitization factors play a very important role. As I initially said, that the breeding place is usually the stagnant water. So we need to maintain the hygiene and sanitization both household as well as in the environment. So household, what are the common areas where the stagnant water can accumulate and which causes the breeding of these mosquitoes? Usually the air conditioners, refrigerators, and if you have a garden or something like that where the pots and broken tiles, utensils where these water can get accumulated. And also waste disposal, like in case of kitchen waste where you have this coconut shells, if they are not disposed properly and during the rainy season, it can cause stagnant water accumulation, and also the breeding of mosquitoes. Environment, if you look at it, the places of construction where you have all these waste and the solid waste are there, and if they are not disposed properly, it can cause water accumulation also, and also in some garages where like the worn-out tires are there. So it mainly, it's a combination of both household as well as the environmental sanitization that really matters.
Thank you, Doctor. Symptoms of dengue, Dr. Madhumitha, if you could tell us.
So, dengue is just another viral fever. Like all viral fevers, it just starts with abrupt high-grade fever. All of a sudden, you have high-grade fever. It's not like you had a prodrome or like slowly you were falling sick. No, suddenly one day you have very high-grade fever, severe body pains. Dengue typically has something called a retroorbital pain. That's like you have pain behind your eyes, you have a splitting headache, and it's sometimes called as breakbone fever. You just don't feel like getting up from the bed. The pain is so bad. So these are the most commonest symptoms of dengue. But dengue can present sometimes with abdominal symptoms also, like loose motions, vomiting. Patients can present with rashes on the first day itself. So that's how dengue presents, be it in adults or in children. But children may not tell you that they have pains. All that they would do is just cry, and the only symptom is fever. So it's many a times confused with other illnesses, like all the other fevers, viral fevers, and it's typically called as flu-like syndrome. The only way that you can differentiate by symptoms a dengue or an influenza or a cold is, yes, you will have some upper respiratory symptoms like cold and cough. But even in those conditions, initially when there is just fever and body pain, it is very difficult to differentiate between whether it's just a common cold or it's a dengue. So you need to go to your doctor if your fever is not settling in a day's time.
Thank you, Dr. Madhumitha. My next question leads to the next question actually. So Dr. Nisha, could you tell us the difference between dengue and common cold in children, especially for the parents?
Yeah, thank you for that question. Yeah, so like Dr. Madhumitha said, one of the differentiating factors between dengue and common cold would probably be the associated symptoms of runny nose and cough, which a lot of children have when you have a common cold, which is associated with a fever in those flu-like illnesses. Dengue most times has got no other associated symptoms, occasionally a little bit of vomiting. Smaller children don't really complain of body pain and eye pain, retroorbital pain, but older children do. They'll complain a lot about a lot of quite severe body pain. Often we find in children that when they have the regular viral infections, a common cold, they're quite active. When the fever comes down, they're running around and playing. Often in children with dengue, especially if they are going to evolve into severe dengue, their activity is quite affected. So you'll find that families are telling you that the child, parents will tell you that the child is not as active. Usually they're up and running when the fever goes down, but this time they're not. So for pediatricians, that's one way of identifying that there's something wrong with the child. And of course, in dengue season or the times when the dengue numbers are rising, then we are more cautious and test children earlier to find out whether they have dengue or not, because that helps us to monitor children. The testing of dengue itself is another complex is a complex issue in itself, because it's not just one test done anytime that will tell you whether you have dengue. We will talk about that in a bit.
Thank you, Dr. Nisha. So for our viewers, I think the last two questions were very, very important, and I think you all should make a note of these symptoms, and if you see in and around that anybody has these symptoms, please visit the doctor as soon as possible. Moving on, Dr. Sivaraj, we would like to know that how do we get to know that it is a viral fever or dengue, or how long we should wait before we move to the tests and investigations?
Very interesting question. And in this season, the most common fevers we are looking at is dengue, and we have this COVID and also the influenza fevers as well. So how do we differentiate it? It's basically clinically. So first thing, let's go to COVID. Okay, COVID, you get fever as well. It can be a high grade, it can be a low grade fever. But the most important differentiating factor is what you develop the respiratory complaints, which is very less commonly seen in dengue. You have these loss of taste, loss of smell, you have the upper respiratory complaints, you have the cough, and in severe COVID, you have the breathing issues as well. So this is the main differentiating factor which differentiates between dengue and COVID. And in other influenza fevers as well, you get a high-grade fever, but you tend to develop these upper respiratory complaints. And this is the clinical differentiation. And if you need to do, if you have the specific lab test as well, you can do the swabs and you can confirm whether it's a dengue or whether it's a COVID or any other influenza fevers. Coming to other viral infections, the other common viral infection which mimics dengue is chikungunya. Both in dengue and chikungunya, you tend to have high-grade fevers with body pain. But in chikungunya, you tend to develop severe joint pains, which we call arthralgia or arthritis, where you develop pain and swelling in all your joints. And sometimes post that fever, after 5 days also, you develop the post-viral arthritis. And the same thing, you have the specific serological test as well for both dengue as well as for chikungunya as well. And sometimes we get to see some rare viral hemorrhagic fevers, which kind of mimics dengue, which do have these hemorrhagic manifestations as well. But for example, like hantavirus, but these viruses are more lethal, more deadly, and it causes multi-organ failures. And we see kind of these cases in ICUs. And other rare things which not commonly seen in our country is the Zika virus, where we have dengue-like symptoms, but conjunctivitis is more common in these Zika virus as well. So sticking to our country, right now we have to differentiate between dengue, chikungunya, and other viral illness, the respiratory illnesses which usually cause. Thank you.
Thank you, Doctor. So, Dr. Sabha, when should one rush to the hospital? What is that identification that you would?
Yeah, another golden question, probably. As you're aware, there are so many symptoms or signs which the common public can make use of to identify that something is wrong, either with the grown-ups or with the kids. As Dr. Nisha said, there are numerous symptoms which were listed out in the last few minutes by the experts. But the most important thing is, when does it become serious? When does it become critical? It's very difficult. I can't ask the public to actually look at the signs and symptoms and find out whether this particular person has a mild infection or a severe infection. All I would suggest is that anything which you think is not right, is not what routinely happens, is abnormal. So you have to take you have to be very sensitive. You have to take even the smallest abnormality and go and see your doctor. Not necessarily to a hospital, a clinic-based practice which is nearby to your place where you live should be good enough, but go and see your doctor. You cannot differentiate between a mild and severe infection by yourself by any means at home. So in short, I'm not going to go into the details of how a severe dengue patient is going to be presenting himself. It's probably beyond the scope. In short, I would say have a low threshold, be very sensitive to go and see your clinician. That's the most important thing.
Thank you, Dr. Sabha. That was some valuable information for all of us. My next question is to Dr. Nisha. We would like you to tell us about the children's safety during dengue times, or what can we do to help our children?
Thank you. Children's safety in time of dengue. So I suspect that what we need to talk about most is about how to prevent children from mosquito bites. So it's good to be aware that once the rains start, that the risk of the number of mosquitoes increasing goes up. So everyone should be aware of, as Dr. Sivaraj said, keeping your environment around your house clean to prevent the growth of mosquitoes, and keeping your house as far as possible protected from mosquitoes. And your children, it is difficult to keep them completely, ask them to wear long sleeve clothes to prevent mosquito bites. But I suppose there are a lot of other options on how to prevent mosquito bites, using mosquito nets, using mosquito repellents which are safe, and that is for older children, and altogether avoiding mosquito bites would be the safest option.
Thank you, Dr. Nisha. The next question is for Dr. Sivaraj. Would you like to throw some light on the diagnosis of dengue?
Whenever we diagnose a disease, we diagnose two ways. One is the clinical diagnosis, the other one is the lab diagnosis. So coming to the clinical part, as everyone has already explained, like how the disease manifests, like usually got a high-grade fever and more than 101, it's a breakbone fever, severe joint pains, and then in a severe form it causes hemorrhagic manifestations also. So what are the specific diagnostic tests we have? We have a lab test. We do something called a dengue NS1 antigen, and which can be done within 24 hours with the onset of the disease, and it will be positive up to 4 to 5 days. And then we have the other serology test as well, which is the IgM for dengue, which becomes positive from the 5th day of the illness as well. But in some scenarios, clinically the patient fits into dengue, but the lab tests are negative. Sometimes it looks like a dengue-like fever. So we have the additional indirect markers which supplements our diagnosis. For example, we have the complete blood count, where it shows a low count, a low WBC count, a low platelets in the 4th to the 5th day. We have some form of hepatitis as well, where the liver enzymes are raised. And so basically, like, if the lab reports are positive for dengue, it's good. In case if they are negative, still we can't rule out dengue. We should look at the patient clinically as well as other indirect markers as well. Thanks.
Thank you, Dr. Sivaraj. Dr. Madhumitha, would you tell us about dengue and platelet count, like some information for our viewers?
At some point, there is always a confusion in what we are dealing with. But there is something that we need to understand is most of the viral fever, there is no specific treatment. What we do is just supportive treatment, and we need to follow up patients regularly. Many a times we don't have a diagnosis, and diagnosis is not a must. All that we know is it's a viral fever, and viral fevers present with low counts, that is WBC count can be low, platelets can be low, and like Dr. Sivaraj said, there may be some other markers like there is elevation of liver enzymes. These all point towards to viral illness, and we treat patients with supportive measures.
Thank you, Doctor. We would also like to request our viewers that in case if they have any questions, they can leave their questions and we will definitely answer them for you as soon as possible. Moving on to our next question, Dr. Sabha, would you like to tell us about some warning signs to look out for?
Oh, okay. The dengue infection has been classified as 3 different categories based on the severity of dengue. The first category, which I would like to call it as mild category, is dengue without any warning signs. Basically, what as our other experts said, this is the mildest variant, that you can get fevers, you can get body pain, you can get headaches and pain behind your eyes, you can get rashes and all that. But it typically behaves like a simple infection which you regularly see in the community. So the next severe category would be dengue with warning signs. So basically these are those patients who deteriorate from mild dengue to a bit more on the severe category. I would call it moderate or severe maybe for understanding purpose. So these patients can have refractory fever or ஜுரம் வந்து நிற்கவே நிற்காது. நீங்கள் என்ன பேராசிட்டமால் கொடுத்தாலும் டெம்பரேச்சர்லாம் ரெக்கார்ட் பண்ணிங்கன்னா எங்கேயோ இருக்கும் 102 103 கான்ஸ்டண்ட்டாக ஃபீவர் இருந்துகிட்டே இருக்கும். சிவியர் பாடி பெயின், பேஷண்ட்டால் எந்திரிக்கவே முடியாது, இப்போ எந்திரிக்கவே மாட்டாங்க லிட்டரலாக, நீங்கள் என்ன சொன்னாலும் எவ்வளோ ஃபோர்ஸ் பண்ணாலும். ஸோ தட் இஸ் வாட் ஃப்ரம் த பேஷண்ட்ஸ் பர்ஸ்பெக்டிவ். அது பேஷண்ட்டாக சொல்கிறது பயங்கர ஒரு அப்டாமினல் பெயின், வயிற்று வலி சொல்லுவாங்க, வாமிட்டிங் நிற்கவே நிற்காது. நிறைய டெங்கி பேஷண்ட்ஸ்க்கு பார்த்தீங்கன்னா ஜிஐ ரிலேட்டட் சிம்டம்ஸ் இருக்கும். ஸோ தட் இஸ் வாட் த பேஷண்ட்ஸ் அந்த கேட்டகரி வந்துட்டு ஒரு சிவியர் வார்னிங் சைன் சொல்லுவோம். இந்த மாதிரி பேஷண்ட்ஸ் வந்து டெஃபினட்டாக ஒரு ஹாஸ்பிட்டல் பேஸ்ட் ட்ரீட்மெண்ட் தேவைப்படுறதுக்கான சான்சஸ் ஜாஸ்தி. தென் இது பேஷண்ட்ஸாக சொல்கிறது. அப்புறம் நம்ம ஹாஸ்பிட்டல் வந்ததுக்கப்புறம் ஒரு கிளினிஷியன், ஒரு டாக்டர் பார்க்குறாங்க. பார்த்ததுக்கப்புறம் அவங்க ஒரு சர்டன் சைன்ஸ் பார்ப்பாங்க. ஃபார் எக்ஸாம்பிள், உடம்புல எங்கேயாவது ஒரு ப்ளீடிங், பேஷண்ட் வந்து நான் ப்ரஷ் பண்ணேன் காலையில், எனக்கு ப்ரஷ் பண்ணும்போது ப்ளீடிங் வந்துச்சு அப்படிம்பாங்க. இல்லை உடம்புல அங்கங்கே புள்ளி புள்ளியாக ப்ளீடிங்க்கான சைன்ஸ் இருக்கிறது. வயிற்றில் கை வச்சு பார்த்தா வயிற்றில் வந்து வலி ரொம்ப ஜாஸ்தி ஆகிறது. இதில் உடம்புல வந்துட்டு அப்நார்மல் third spacing of fluid ன்னு சொல்லுவோம். என்னென்னா சிவியர் டெங்கி ஆகும்போது blood vessels அஃபெக்ட் பண்ணும். ஸோ blood vessels capillaries-லாம் வந்து fluid leak ஆக ஆரம்பிச்சிடும். It starts leaking and going into the abnormal spaces in the body, which clinicians can identify. So இந்த மாதிரி findings-லாம் இருந்துச்சுன்னா, then again these are warning signs that that patient can worsen to severe dengue. So that is another thing. Then there are a lot of blood tests that we do, as Dr. Sivaraj mentioned. ஒரு சில blood numbers, like Dr. Madhumitha said, platelets and so on. These are very important cells which are important for controlling the bleeding in the body. உடம்புல எங்கேயாவது ரத்தம் போக்கு இருந்துச்சுன்னா அதை நிறுத்துறதுக்கு பாடியோட நேச்சுரல் மெக்கானிசம். அது லோவாக இருக்கும்பொழுது ப்ளீடிங் வந்துச்சுன்னா நிற்கவே நிற்காது. ஸோ அந்த செல்ஸ் பார்ப்போம். அது ரொம்ப லோவாக இருக்குது அப்படின்னா we have particular numbers. அது கீழே இருந்துச்சுன்னா அட்மிஷன் போடுறது பெட்டர் அப்படிங்கிற மாதிரி மானிட்டரிங் பர்பஸ்க்காக. ஏன்னா தேவைப்பட்டால் கொடுக்கலாம், ரொம்ப குறைஞ்சிடுச்சுன்னா கொடுக்கலாம். அது ஒன்று. அதுக்கப்புறம் ஹெமட்டோக்ரிட்னு சொல்லுவோம். ஸோ அந்த வேல்யூ ரொம்ப ஜாஸ்தியாக இருந்துச்சுன்னா தட்ஸ் நாட் அ குட் சைன். ஒரு சில ஸ்கேன்ஸ் பண்ணுவோம். லிவர் சைஸ் பெருசாக இருந்துச்சு, லிவர் என்சைம்ஸ்ன்னு சொல்லி டெஸ்ட் பண்ணுவோம். அதெல்லாம் ஸோ லிவர் கேன் கெட் அஃபெக்டட். ஸோ technically any part of the body can affected with severe dengue. So we have multiple warning signs. These are some of the common ones. Yeah.
Thank you, Dr. Sabha. I hope our viewers are also getting all their questions answered. And as I mentioned earlier, you can also leave your questions in the comment box and we would answer. And Dr. Sabha, in continuation to the answer that you just gave, we have a question by one of our viewers. And they're asking that does dengue require an ICU admission? And if it does, what kind of care is given in ICU and how does it help?
Yeah. So not all patients would require an intensive care management. So basically those patients who unfortunately deteriorate in spite of treatment or who present late to the hospital, they are the ones who require intensive care management. So these are basically severe dengue patients, and the treatment depends on which part of the body or what manifestation they have. For example, 3 important problems that we see with patients who come to the intensive care. ஒன்று வந்து நான் இப்போ சொன்னேன் இல்லையா, capillary leak. அது blood vesselsல ப்ராப்ளம்ஸ் இருக்கும். ஸோ blood vessels start leaking fluid into the abnormal spaces. அந்த மாதிரி லீக் ஆகும்போது breathing difficulty வரலாம். தி வைட்டல் ஆர்கன்ஸ் அப்டாமினில் வந்துட்டு லிவர் கேன் கெட் அஃபெக்டட். ஸோ இதெல்லாம் வந்து ஒரு வார்ட் அட்மிஷனில் இட்ஸ் வெரி டிஃபிகல்ட் டு மானிட்டர் அண்ட் த ரெஸ்பான்ஸ் டைம் மைட் நாட் பி ஆஸ் குட் அஸ் தி இன்டென்சிவ் கேர். ஸோ இந்த மாதிரி பேஷண்ட்ஸை மானிட்டரிங்காகவும் ஃபர்தர் மேனேஜ்மெண்ட்டுக்காகவும் வி பிரிங் தெம் டு தி இன்டென்சிவ் கேர். இது ஒரு ப்ராப்ளம். ரெண்டாவது ப்ராப்ளம் முதல்ல சொன்ன மாதிரி ப்ளீடிங் இஸ் அ வெரி சீரியஸ் மேனிஃபெஸ்டேஷன். மைல்ட் ப்ளீடிங், இந்த பல் விளக்கும் போது கொஞ்சோண்டு பிளட் வர்றது, உடம்புல அங்கங்கே ஸ்மால் ஸ்பாட்ஸ் இருக்கிறதெல்லாம் ஓகே. பட் பிளேட்லெட் கவுண்ட்ஸ் ரொம்ப க்ளோஸாக மானிட்டர் பண்ணுவோம். பிகாஸ் தட்ஸ் அ செல் which helps with stopping the bleeding. சொன்னேன் இல்லையா, அந்த மாதிரி தான். ஸோ when the platelet count drops to certain abnormal values, we have to transfuse them. platelet நம்ம வெளியிலேருந்து அவங்களுக்கு கொடுக்க வேண்டியிருக்கும், transfuse பண்ண வேண்டியிருக்கும். ஸோ அது ஒன்று. உடம்புல வேறு எங்கேயாவது ப்ளீடிங் இருக்குது, as டாக்டர் நிஷா செட், menstruation பீரியட்ஸ் போகிறப்போ எக்ஸஸ் ப்ளீடிங் இருக்குது, இல்லை வேறு எங்கேயாவது பார்ட்ஸ் ஆஃப் த பாடியில் ப்ளீடிங் இருக்குன்னா அது அந்த ப்ளீடிங்கை ஸ்டாப் பண்ணுறதுக்கு நம்ம என்ன பண்ணலாம், ப்ளஸ் பிளேட்லெட் ட்ரான்ஸ்ஃபியூஷன் ரெண்டுமே சேர்ந்து பண்ண வேண்டியிருக்கும். அண்ட் தேர்ட் and equally important problem வந்து dengue, as most of the infections can affect any part of the body head to toe. பிரெயின் அஃபெக்ட் பண்ணலாம், ரொம்ப கன்ஃபியூஸ்டாக இருப்பாங்க, ரெஸ்ட்லெஸ்ஸாக இருப்பாங்க, பிரெயினில் கூட ப்ளீடிங் வரலாம். ஹார்ட் அஃபெக்ட் பண்ணலாம், பிளட் ப்ரெஷர் ட்ராப் ஆகலாம், ஹார்ட் ஃபங்க்ஷன் குறையலாம். ப்ரீதிங் அஃபெக்ட் பண்ணலாம், லிவர் அஃபெக்ட் பண்ணலாம், கிட்னி அஃபெக்ட் பண்ணலாம், கிட்னி ப்ராப்ளம்ஸ் வரலாம். ஸோ தட்ஸ் வேர் இன்டென்சிவ் கேர் pitches in. All the organ functions are very closely monitored in the intensive care units, and whatever organ is affected, the organ support is given appropriately. In short, இதுதான். So these are the sickest category of patients, and fortunately not all patients go to this sick category. Only very few patients, especially when they get reinfected. Second infection, dengue first வந்துட்டு second time வரும்பொழுது these patients can get very sick and they get admitted in intensive care unit.
Okay, thank you. We have another question again by our viewer, and I think that takes me to Dr. Madhumitha. That does every patient require a platelet transfusion suffering from dengue?
That's a very important question. But before answering that question, I'll just add to Dr. Sabha's answer. There are 2 very rare manifestations, what we call as hepatorenal and hepatopulmonary syndromes with dengue also, where both your liver and kidney fail at the same time and you would require dialysis. So that's when patients will be admitted in the ICUs. And like Dr. Sabha explained very well. Third space loss ன்னு சொல்லுறது வந்து நுரையீரலை சுற்றி நீர் சேர்த்துக்கலாம், வயிறை சுற்றி வயிற்றுக்குள்ளே நீர் சேர்த்துக்கலாம். ஸோ அந்த மாதிரி வாட் வி கால் அஸ் பல்மனரி இடிமான்னு சொல்லுறது. ஸோ அந்த மாதிரி சமயத்தில் வந்து பேஷண்ட்ஸ் வுட் ரெக்வயர் ஐசியூ அட்மிஷன்ஸ். சம்டைம்ஸ் சில பேஷண்ட்ஸ்க்கு வந்து அந்த மெக்கானிக்கல் வென்டிலேஷன்லாம் தேவைப்படலாம். இதெல்லாம் வந்து ரேரஸ்ட் காம்ப்ளிகேஷன்ஸ் ஆஃப் டெங்கி. All patients will not land up in this place. What is most important is reaching out to your doctor at the right time. Many a times நம்ம என்ன பண்ணுறதுன்னா, வீட்டிலே இது சாதாரண காய்ச்சல், ஒரு பேராசிட்டமால் போட்டுக்கோ, பேராசிட்டமாலில் கம்மி ஆகலைன்னா we take ibuprofen, காம்பிஃப்ளாம், ப்ரூஃபன்றது வந்து ரொம்ப காமனான ஒரு வலி மாத்திரை. ஸோ யாருக்கு அப்படியே வந்து ஃபார்மசிலேருந்து வாங்கி ப்ரூஃபன் போட்டுப்போங்க. ஸோ விதவுட் like finding out that this is dengue, டெங்கி இல்லை அப்படின்ட்டு தெரியாமல் வந்து இந்த ப்ரூஃபன் மாத்திரை, காம்பிஃப்ளாம் மாத்திரை இதெல்லாம் போடக்கூடாது. த ஃபீவர்னா ஒன்லி சேஃபஸ்ட் மெடிசன் இஸ் பேராசிட்டமால். ஏன்னா இந்த மாதிரி மாத்திரைகள் கேன் காஸ் further drop in platelets. So coming to that answer, platelet எல்லாருக்கும் வந்து platelet transfusion தேவையா? No, as I said before, every 12 hours வந்து platelet check பண்ணணும். 12 hours check பண்ணலையா, every day வந்து check பண்ணணும். Once the fever settles, at least 24 hours இல்லை 48 ஹவர்ஸ்க்கு ஒரு தடவை செக் பண்ணணும். இஃப் யூ see that drop in platelets, then you will have to do a more frequent monitoring. சில ஹாஸ்பிட்டல்ஸில் சில கண்டிஷன்ஸில் வந்து இஃப் த பேஷண்ட் இஸ் டூயிங் ஃபைன், நல்லா சாப்பிட்றாங்க, வேறு எதுவும் ப்ராப்ளம் இல்லை, வாமிட்டிங் இல்லை, தே கேன் டேக் ஓரல் டயட், தென் வி டூ அ க்ளோஸ் ஃபாலோ அப் ஃபார் பேஷண்ட்ஸ் ஈவன் இஃப் த பிளேட்லெட்ஸ் ட்ராப்ஸ் till 50,000. But 50,000ல வந்து the normal platelet value வந்து should be anywhere above 1.5 lakhs to 3.5 lakhs. So இதுக்கு கீழே வரச்சே 50,000 கிட்ட வரச்சே பட் பேஷண்ட் ஹேஸ் ஒரு ப்ளீடிங் மேனிஃபெஸ்டேஷன்னா காலையில் பல் விளக்கிச்சே வந்து ரத்தம் வருது, இல்லை யூரின் போச்சே வந்து செவப்பாக போகுது அப்படின்னா you need to get admitted immediately. Transfusion usually we keep it at platelets dropping below 10,000. இதுதான் கவர்மெண்ட் கைட்லைன்ஸ் இப்போதைக்கு. ஏன்னா unnecessary transfusion is also not good. Dengue is very the best part of dengue is fever வந்து fever வரும், தானாக சரியாக போயிடும், பிளேட்லெட்ஸும் தானாகவே வந்து இம்ப்ரூவ் ஆகிடும். ரொம்ப பெரிய வந்து மருந்தோ இல்லை வந்து ரெமிடிஸோ கிடையாது. த பாடி ஹீல்ஸ் பை இட் செல்ஃப். ஆல் தட் யூ ஹாவ் டு டூ டு த பாடி இஸ் ரெஸ்ட், கிவ் plenty ஆஃப் fluids, பிடிச்சதை சாப்பிடணும், அவ்வளோதான். ஸோ த இண்டிகேஷன் ஃபார் platelet transfusion இஸ் somebody's platelet has dropped below 10,000 or somebody's platelets is below 50,000 and they have some bleeding manifestations. So
let me add something here.
Yes, please.
See, whenever it comes to dengue, people usually panic and they read about stuff and they get confused about this low platelets. See, what happens in dengue, as everyone are telling, it goes through 3 phases. The first phase is the febrile phase, the second phase is the critical phase, and the third phase is the recovery phase. See, whatever you do, till the 5th day, you will have high-grade fever, okay? And only from the 5th day, the fever settles down normally. And the critical phase starts from the 4th day to the 7th day. Suppose you do a platelet count early in the disease, say in the first day or second day, the platelet count is usually normal. What happens, the platelet count and the WBC count starts to fall from the 3rd day. So if you plot a graph, the WBC count first starts to come low initially, then the platelet count starts to become lower. And then the WBC count in the recovery phase from the 6th to the 7th day, it starts improving, and then the platelet count also starts improving. So don't panic. So at what level of platelet count you need to panic about? See, the normal platelet count, as Dr. Madhumitha said, it's around 1,50,000. So when the count becomes less than 1 lakh, you need to monitor yourself. So when you have a cut in your body, it bleeds. You put a pressure, the bleeding stops. Why is it happen? That's because of the function of the platelet. So when the platelet count becomes low, you have a chance of bleeding. So what are the risks of getting a bleed? So when the count is between 20,000 to 50,000, you have a moderate risk of bleeding. When the count is between 10,000 to 20,000, you have a high risk of bleeding. And when the count is less than 10,000, you have a very high risk of a spontaneous bleed. So as Dr. Madhumitha pointed out, when the count is less than 10,000 and there's no evidence of bleed also, to prevent a massive bleed or something, we transfuse platelets. When the count is between like 20,000 to 50,000 and the patient has got hemorrhagic manifestations, we transfuse platelets. There are no specific medicines to improve platelet count. It is, if the platelet is low and the patient has got bleeding manifestation, you transfuse platelets. Thank you.
Thank you, everybody. Dr. Nisha, would you like to give us some insight on the recovery rate of dengue affected people?
So, as we have all discussed earlier, the 3 phases of dengue, and dengue automatically, after you cross the critical phase, it goes into the recovery phase. So, I think the emphasis is that all children with dengue and adults will enter their recovery phase. It is just that we support the critical phase depending on how severe the infection is for each child. So once every child will go into recovery, it's just it takes different times. If the illness is more severe, it takes a little bit more time.
Okay. Dr. Madhumitha, would you also like to add?
So the statistics by the World Health Organization says that the mortality rate in dengue is less than 1% even in the severe form of dengue, if it is adequately addressed at the right time. So 99% of the time you will survive. So do not panic. But you need to reach out to the right place, the right doctor at the right time and follow their advice. That is most important. Self-medication and staying at home and presenting at the late, at a delayed presentation can cause trouble.
Thank you. So generally we see a debate on home remedies in treating dengue, and the 2 popular ones that comes to everybody's mind is kabusir kudineer and papaya leaf. So Dr. Sivaraj, we would like to know from you, will these things or these home remedies lessen the severity of dengue?
See, whenever I see a patient coming to me with dengue, they have a lot of questions actually about home remedies, and many people, they do follow their own home remedies, and by Ayush recommendation and the Siddha practitioner's recommendation, the Kabasurna Kudineer and as well as the papaya leaf extract juices are recommended by them. And these have got antiviral properties, anti-inflammatory properties as well, and immune enhancing properties. So if in case a patient asks me, can he take it, I specifically don't have any contraindications to it. But what happens, see, most of the time, these patients have got a lot of gastric complaints. They have like less oral intake is very less, they are vomiting. And if you look at this papaya leaf extract juices and all, அது ரொம்ப கசக்கும் பேஷண்ட் வந்து many times they drink that, they start vomiting. So I leave it to the patient's choice to take it. And Kabasurna Kudineer has got some effects in for respiratory complaints as well, for cough and as well as for fever as well. So there are no specific contraindications for it.
Okay, thank you. Dr. Nisha, would you like to add to these home remedies?
As Dr. Sivaraj said, that it's true, most families are very anxious when a child has dengue, and everyone is always, you got to get a lot of advice from neighbors, friends about what you need to feed the child or thing. But most important to remember is whatever happens, it's important to know, I mean, as medical practitioners, we know dengue follows a pattern, and we know that we need to give supportive care at the critical phase, and automatically dengue will go into recovery phase. The platelet count will rise regardless of what we do. And it is important therefore to for children not to force them to drink things that they find it difficult. It will increase their vomiting, decrease their appetites. We are trying to increase the amount of fluid they drink. If giving all this will decrease that, that probably is not advisable. So it's probably best to just keep them well hydrated. And the severity is not in your hands. If the child has severe dengue, then the child requires supportive care in a hospital during that time. And all children will enter their recovery phase, and their platelet count will rise, because that is the process of dengue. So giving things like papaya, a lot of people also believe, I think there was something that suggested that kiwi fruit was, so we find a lot of, so fruit per se won't really harm the child. So anything that doesn't harm the child can be offered, but don't force children to drink something that will cause them to have more vomiting.
Thank you, Dr. Nisha.
Can I add something to
Yes, please.
there is recommendation on Nilavimbu Kashayam also for dengue. See, again, all this, whatever, நீங்கள் என்ன சாப்பிட்டாலும் சரி, பிளேட்லெட் ஏறணும்னா அது தானாகவே ஏறிடும். நீங்கள் நிலவேம்பு கஷாயம் சாப்பிட்டோம், இல்லை கபசூர குடிநீர் சாப்பிடலாம், இல்லை papaya leaf juice. All these extracts may have benefit, but your normal food also has enough thing to keep you energetic. So fever and all that you have to do is keep yourself well hydrated. Half your problem will be solved over there. So இந்த மாதிரி ஒரு ஃபோர்ஸ் பண்ணி ஒன்று சாப்பிட்டுட்டு அப்புறம் கேஸ்ட்ரைட்டிஸ்னால திருப்பியும் வாமிட்டிங் அது சாப்பிடாம இருக்கிறதுக்கு முதல்ல choose what you want to have. In fact, when most of you would ask like என்ன சாப்பிடலாம், what is the food dietary recommendation, actually whatever you've been eating all this while you eat, there is nothing special that is required for dengue. So adnala sometimes parents do ask me, he wants to eat Maggi, he wants to eat pizza. Fine, give him Maggi, pizza. It's a nice sign that the child wants to eat. So please give whatever the child wants to eat, or whatever you want to eat, you can eat. Curd sapta cold varum. No, you want to eat curd? Have curd. There is no harm. Have it in room temperature. That is what I would say.
So thank you for answering that. Our viewers, this information is for you, that we have reached the end of our session, and whatever questions that have not been answered, you can leave them in the comment section and our doctors will be very happy to answer that. You can also call us at 044-452-42407, and you can also get in touch with us through our website www.mgmhealthcare.in. Moving to the next question, Dr. Sabha, would you like to give us some tips on a diet and exercise for a dengue patient?
Yeah, again, one of the very common doubts people have these days, and I think most of the diet part was just answered by Dr. Madhumitha, and I completely agree with her. To be honest, there is no particular diet that we suggest for dengue in the first place. As she correctly said, it's just your usual diet. Ensure that it's in the proper balance. You have enough carbohydrates, enough proteins, vitamins, minerals and all that. Of course, you can supplement it with fruits and vegetables, like, make it a habit from that point onwards. Again, as Dr. Sivaraj was mentioning, a lot of patients tend to take all these natural remedies and end up in gastritis and vomiting and diarrhea and all that. And in addition to that, you'll be taking symptomatic medications, tablets, which can worsen your gastritis. So the point is, try not to take spicy food at least. Probably try and avoid oil a little bit during this time so that you don't worsen the gastritis. That's one thing I can talk about diet. And other than that, it's usual routine, gentle diet, whatever the kid or the grown-up wants. With the exercise part, again, just take it in your own stride. There is no specific thing that, it's good to be active. But again, it's symptoms. If that person is really tired, it means the body wants rest. Take enough rest. If some people might be quite energetic in spite of having fever also, between fevers they'll be active. Yes, be active. The most important thing is, if one family member has got dengue, it means that there is a very high risk for the other family members can also have, because they are in a mosquito bite borne area. So that's very important that they keep looking for any areas which can breed mosquitoes. And the madri veetla kosu nariya irka adella eppadi pandradhanu paakano. So other than that, activity wise, there is no specific activity or anything. Just keep yourself as active as possible. All of that.
Thank you, Dr. Sabha. Dr. Sivaraj, any do's and don'ts that you would like to add to the same question?
Dr. Madhumitha and Dr. Sabha literally answered everything, but as Dr. Madhumitha said, avoid self-medications. See, there are no specific medications for dengue, okay? Like for malaria, for typhoid, you have specific anti-malarial medications or the antibiotics for it. For dengue, it's more of a conservative management, look for the complications, and then we manage the disease. So basically, in the initial phase of the disease, when there's high fever, just take paracetamol round the clock. And for pediatric population, according to the body weight, it can be adjusted. And avoiding unnecessary painkillers. Medically, we call it NSAIDs. that should be avoided because it will have an effect on reducing the platelet count. And in case if the patient is at home, take adequate fluids and diet, as Sabha said, a bland diet which is like less spice and less oil to prevent gastritis. Take a lot of fruits, more of citric fruits, and some food items will have some immune enhancing properties like garlic, almonds and turmeric that can be added as well. So as a whole, what I like to conclude is anyone who gets dengue will have to go through these 3 phases. That is the febrile phase, the critical phase and the recovery phase. So it depends on each patient. Sometimes they will have a mild course, some patients will have a stormy course as well. So don't panic, go to your physician, listen to them and just follow the advice. Thanks.
Thank you, Dr. Sivaraj. Concluding the session, one common question to all of you all. How MGM is prepared and well equipped in every possible way to treat dengue in any stage? And Dr. Nisha, I think we'll start with you.
So yes, the Department of Paediatrics and Neonatology in MGM, we call ourselves MGM Children's. How we are prepared is because we are all very aware of how to manage dengue. It's important to go to a pediatrician who is able to look at that and be able to manage dengue. And we also have an intensive care unit that will also be able to manage dengue. So I think we are fully covered to manage any severity of dengue, a child with any severity of dengue.
Thank you. Dr. Sabha?
Yeah, again, I mean, as Dr. Sivaraj mentioned, it's got 3 different phases, and the phase which every one of us is worried about is the critical phase, and where any part of the body literally can be affected. So our acute care setting, which involves the emergency department and the intensive care unit, both the areas are highly equipped with doctors who are specialized in managing these sort of problems. We have managed hundreds and hundreds of acute infections like this. So when it comes to the critical care setting, we are definitely fully equipped to manage any problems. We have all specialties under one roof. So that makes it a comprehensive treatment. So any person who comes in with any sort of problem related to dengue, we should be able to safely take care of it.
Thank you. Dr. Madhumitha, any closing lines for you?
The ICU head has already said that this is a multi-specialty hospital. What more do you want? You have everything under one single roof. And to mention, we have a blood bank in our hospital. So even in the slightest possibility that a platelet transfusion is required, we have our own blood bank. And I just wanted to add, on a lighter note, dengue fever na adichu pota mari irukum. எது பண்ணாலும் சரியாகாது. ஸோ அந்த டைமில் ரெஸ்ட் எடுங்க, அவ்வளோதான். அது அடிச்சு போட்டது வந்து 10 ஆள் அடிச்சு போட்ட மாதிரி இருக்கும். ஸோ அப்போ நினச்சி பார்க்கலாம்.
Dr. Sivaraj, we'll have the closing lines from you.
See, we as a hospital, we have round-the-clock consultants in the outpatient, in internal medicine, pediatrics, as well as in infectious disease to manage outpatient dengue patients. And in case the patient requires admission, most of the time 90% of the patients will require ward admissions only, and most of them are admitted in the ward and discharged from the ward. Very rarely 5 to 10% of the patients do become sick and they require an ICU care, where we have the ICU head and the round the clock ICU care as well. So that's what, as I think we are covered.
So I am sure that these questions and answers have clarified a lot of doubts that we all had, and I sincerely thank all our doctors to pass on this information to all our viewers. Viewers, thank you so much for joining us. As mentioned already, if you have any questions, please do not hesitate. Ask us in the comments or feel free to call us or contact us through our website. We sincerely feel that more questions coming in from you would help us serve you better. And we do believe that this is a motivation for all of us to keep doing more better. Please share this among your social circles, friends and family, and I'm sure it will be useful for all of them. Thank you very much.